So Frank, about 6 weeks ago, you announced that you were providing $500,000 to help people unfairly targeted by medical debt collectors. What have you guys found?
Well, so far we've been contacted by 242 different individuals. We've interviewed and had consultations with 141 of them. And we've agreed to take the cases of 102 of them. That doesn't mean of the 141 we've talked to, that's all we're going to take. We're still in process, but we only take the cases that we think we can win, the ones that we think that were mistreated or have a good argument against how they were treated or what they're being asked to pay. Those are the ones we're taking.
Over 100 cases, that's a lot of cases.
It's a lot. This is a big deal. This is not a little deal. This is a big deal. Here are the things that folks are telling us. The medical service provider, in some cases, either fails to bill the insurance company or improperly accounts for the bills that have been paid, so errors. And the collection companies still want to be paid, even though the errors are made evident to them. In some cases, there was no bill. In some cases, in many cases, the first time that the patient even knows, the debtor even knows that there's a bill, is when they hear from the collection company. Certainly there are excessive, huge attorney fees being assessed to these folks, pre-judgment and post-judgment. Several times people have told us they have been told that the debt was paid off, they thought the debt was paid off, but then they get bills for attorney fees. There's several cases where the collection company sends notices that are harassing, misleading, threatening we're going to send the sheriff after you, and listing, in our opinion, totally improperly what they can instruct the sheriff to do. We'll instruct the sheriff to do this and this and this and this to you. And in some cases, telling them don't get an attorney because it'll only cost you more. You're going to run up your attorney fees, and if you get an attorney, it'll only cost you more because we'll have to fight them, and your attorney fees will be more. You'll have to pay them and us. These people are, they've been hit with medical debt. It's expensive. It reminds me of the looters that go in after a tragedy. After a flood or a fire or a hurricane, and the looters come in and try to take the spoils from the people who have already been damaged. By the way, it's not just MRS. There are other collection companies, but MRS is by far, of the 104 cases I think that we've taken on, all but 5 of them involved this one company, MRS. So here's some of the more egregious things. I'm only giving the ones that we've heard several stories about. These are patterns: refusing to stop collecting efforts on debt that has been discharged in bankruptcy; refusing to stop collection efforts on debt that was paid by the insurer even after the medical service provider demands that the collection agency stops billing. So they ignore the company, and the pattern there is they say, look, we understand there was an error, but we got involved. So since we got involved, you got to pay our fees, even though the poor patient had nothing to do with making the error in the first place. Garnishing bank accounts that contain only funds from Social Security, disability, veteran funds, or other protected funds that are protected by the federal government. They're off limits. Misleading debtors into believing that they do not need to file anything with the court or show up in court after a complaint has been filed. Accepting payments, setting up a payment program, and having people pay sometimes for years, sometimes for many years, only to learn after the fact, thinking they're making progress, that the bills that are being tacked on, either transaction fees or attorney fees that are being tacked on to the bill as they're paying, to learn after many, many years they've not made any progress. Now, if you have any empathy for people at all, you've got to say, somebody's got to take issue with some of this stuff. If these stories are true, all of them, or some of them are true, some of these things would be illegal actions if they're true. So we're going to look deeper. We're going to take these cases on, and we're going to see what we can do. MRS alone has filed 1,600 cases in the last 8 months. That's 200 cases a month. That's 10 cases a day. Think about the amount of work that goes into not only the attorneys who are filing these cases, but the court system, the burden on the court system. It's also curious that Intermountain Emergency Physicians, that's the emergency room at IRMAC, accounts for 71% of all the people who contacted us. More than all other medical doctors and institutions in southeastern Idaho, many more than all of them combined, 70%, come from the emergency room at ERMAC. And that's run by a group of doctors. It's a separate entity from ERMAC. But really, something really curious there, Bryan Smith, who is an owner of MRS and the partner attorney from Smith Driscoll, he's listed as the agent of Intermountain Emergency Services by the Secretary of State. So I think that's curious. There's a lot more to kind of be looked into here, and hopefully the medical institutions and the doctors will be transparent with their interactions with these collection agencies, that we'll learn a little bit more about their side of the story. We think that doctors deserve to be paid. Hospitals deserve to be paid. That's not what that we have a beef with. It's the attorney fees that are being tacked onto these bills. And this is an interesting problem in the MRS situation. MRS basically hires themselves. So normally a collection agency would, they have attorneys if they're going to turn it over to attorneys, but they would negotiate a good fee with the attorney, especially if they're going to use them exclusively. They'd be in a position to negotiate a good fee. Well, when you're negotiating with yourself, you're probably not going to negotiate really hard. So the fees seem to be exorbitant. I think it's important to be fair here. There's another side of this story, I'm sure, and they should be able to tell their side of the story. From our side, it looks pretty bad, really. But I think we shouldn't, that my hesitancy to even talk about this in the press as to taking people trial by press, I think is it's not fair. But I do think people deserve to know what we're hearing. I wouldn't be bringing these things or making them public if we were hearing these stories from one person or even 2 or 3 people. We're hearing these stories over and over and over from now dozens and dozens. Everybody has their own story, but there are so many similarities to what we're being told that I think it warrants making it public that at least this many people are having those stories, and I think that it warrants more looking into, and folks deserve their fair day in court.